a lot of scar placement is patient preference. It's as simple as that. Some patients will say to me, oh, look, I want to have a low scar. And I'll say, fine, okay, well, we'll do that. I want to have the scar. And then okay, well, fine, we can do that. There are a few patients who may fall into the category of they may want to have a lower scar, but they may not be able to have it, okay? And those patients may include, usually they are patients who do not have a lot of tissue in the what we call the upper pole or the top part of their chest, okay? Because when we do the surgery, we make the cut and then we lift this skin up and we pull it down, okay? And we then stitch it in. But to pull that down, you've got to have enough tissue up here, enough skin to be able to pull it down, okay? To get it all the way down to where you want, where the pec muscle inserts, okay? If you haven't got enough skin up here and you make your cut down here and then you go to pull it, it's like, oh, I'd say a rude word. I'd say a very rude word if that happened. But so you can't do it. So for those patients, it's like, well, you're only, you have to think about having it at the level of the nipple. Yeah. Okay. So that's one. And another group of those patients would be patients who may have had a previous breast reduction. Okay, because again, when you do that, a breast reduction basically involves cutting out excess tissue, pushing the nipple up, pulling the skin down and round, okay? So again, you're using up a little bit of this tissue here, because I do have some patients who come to me and say, oh, I don't know whether I want to have top surgery or I just want to have a reduction to start with. What do you suggest I do? And I sort of say, well, look, it's your journey, it's up to you, but go and have a talk to whoever you know your GP is and what have you, to Sven or what have you, Pauline, whatever. Talk to them about it, but bear in mind that you may be sort of limiting your ability to have a scar where you might want it on if you go on for top surgery. That you might not get that far, I don't know, but do you know what I mean? It's like you just bear that in mind when you are thinking about how you want to plan it, okay? So that's that. Nipple sensation. Now, nipple sensation is, again, one of these things people talk about. Nipple sensation is incredibly variable, okay? If you move the nipple as a graft, okay, you will not, I tell people you will not get nipple sensation back, okay? In reality, I've had more than a few guys come and tell me, oh, I've got nipple sensation back, I can feel my nipple again. I say, oh, that's fantastic, that's great. So don't plan on it if you're having the surgery, okay? Some patients who have a scar at the level of the nipple want it moved on what we call a pedicle, okay? In other words, it's still attached, okay? And the reason they want that is because they want to try and maintain nipple sensation, okay? In reality, you have to probably assume that even if you do it that way, you're not going to have much sensation. And the reason I say that for is because the sensation comes to it by nerves, okay? And those nerves run around the body, and when they come to the chest, they run around the bottom and then they come up. And as they come up, they come through the tissue coming up towards the nipple, okay? So when you do this operation, and we do it based on what we call a superior pedicle, which is probably leaving it attached, okay, that tissue is thinned right down because we don't want to leave any tissue on the chest. That's why we're there, sort of thing. Do you know what I mean? I think it's well, yeah, exactly. But to increase, so by thinning that right down, you're really removing almost all of the nerves that are going anywhere near the nipple anyway. So you're probably going to end up with a numb nipple, even if you're trying to maintain it. You can say, well, you know, I mean, the thing to say then is, well, leave some more tissue. And it's like, yeah, exactly. It's like, well, yeah, but that's not what we're trying. Do you know what I mean? It's like, yeah. So I will often, yeah, if someone says to me, oh, I want the pedicle because I want the sensation, so I sit there and say, look, I can do it that way, that's fine, but you're probably not going to have sensation. And talking with that about pedicles and things, if I see a patient who wants, who's got a very large chest, as I say, the tissue that if they want a pedicle, the tissue that you have to leave behind, if it's a long way, if the nipple's sort of sitting, say, down here, you've got to leave a length of tissue like that, okay, for the nipple to survive, okay? And that has to then be folded up into the chest. So you're going to, and I've had guys come and see me and say, oh, is there anything we can do about this? I had this done with the pedicle, and it's like, I still got all this here. And I say, well, yeah, that's keeping your nipple, that was keeping your nipple alive, okay? That's why they've done that. Do you know what I mean? It's like, well, okay, so if you do have a long distance from here to there, and you really can't have a superior pedicle, so what I tend to do for guys in that instance is say, look, we can give you the scar at the level of your nipple, but we'll have to do it like we do the low graft, where you take the nipple off. Then you can get rid of all the tissue and put the nipple back on as a graft, and it still stays flat.
Okay, cool.
I mean, I have a number of patients who come and see me who say, I don't want my nipples back on at all, full stop. Okay? That's one group of patients that I have who say, look, I just don't want, and say, okay, that's fine. Some patients will have, might have very large nipples, okay? In which case I do sort of say to them, look, putting that nipple back on as a graft, and I always hesitate when I say this, the result can be quite unpredictable as to how big your nipple is going to be when the graft is healed, okay, because you can't predict it, okay. So for those patients I say what an alternative that we can do is that we can build you a nipple from scratch. Okay, what we call, someone, I don't know, some patient said to me, oh, someone heard you call it nipple origami. Now, so, okay, there you go. It's like, okay, I can't remember saying nipple origami, but it's a good description of it, because that's what it's like. It's exactly the same as when a patient, a lady who has a breast cancer, has a breast removed and has a breast reconstruction, you make a nipple for her and stuff from scratch. It's no different, essentially. We just make a male nipple in the right position from scratch. Okay, and what I say to patients who have got large nipples is, it's not necessarily a better result, it's a more predictable result doing that than doing a graft. Because as I say, I don't know how that grafted nipple that's big is going to, I don't know how much it's going to survive, how much it's going to take, how much it's going to flatten. I do know when I build a nipple from scratch, I know exactly how big it's going to be. Okay, and we usually make them a little bit bigger than we want them because they do shrink a little bit. So, yeah, nipples, the only downside with grafted nipples is that you have to dress them until they heal and stuff. That usually takes a couple of weeks, but it can take a little bit longer. It can drag on and on and on. And the temptation is to start interfering while they're healing. That's the worst thing you can do. Is usually just keep dressing them. As long as they're clean and they're not infected, they will heal. Okay? A lot of people will say that medicine essentially is the art of occupying the doctor while the body heals itself, which is really quite true, because I mean that's, you know, when a nipple's healing, the last thing you want is someone going in and fiddling with it. It's like, just let it do its thing and it will get there, but just have some patience, just let it, it'll get there and stuff. So that can prolong that a little bit, but as I say, nipples, it's patient's journey. They can decide what they want. I'm quite happy, you know, and as I say, I'm actually, and in all honesty, I am seeing more and more guys who are coming through who are wanting surgery, who are saying, I want you to make some nipples for me. I don't want, or they say, I don't want my nipples, or I want you to make my nipples for me afterwards.